Let's talk all things teenage pregnancy now, and we are joined on the line by Director of Child Welfare South Africa, Dr. Benny Obayi. Dr. Benny, good morning. Welcome to Morning Live.
Good morning.
Let's talk about what is happening towards the end of May, which is considered Child Protection Month. What does this mean to ordinary people on the street?
Child protection, May is considered Child Protection Month, but Child Protection Week starts actually tomorrow. It starts on 29th until the 5th of June. This is the period that stakeholders in the child protection sector talk about issues that concern children and engages the different stakeholders on how to address those issues. Now, this year, the focus is on teenage pregnancy. Now, there's a report released by Stats SA that talks about the total of over 33,000 deaths that occurred in 2020 of young people below 17 years and below. And over 600 of those children given birth by those between 10 and 13 years. And this is a source of concern for those in the sector. So that's why the concern this year is to raise awareness, to talk about the issues of teenage pregnancy and how, as a collective, we can all start addressing the issues.
Mm-hmm. What are some of the major complex drivers behind teenage pregnancy?
There are so many factors that drive it, but when you look at the period we're talking about, it's in 2020, and that was during the time of the lockdown. So it can be assumed that most of it happened when the children were at home. Now, there's not been a lot of research to understand what really happened within that period, but when you look at issues of children that do not have access to reproductive health services, children that do not have recreational facilities, they are not able to go to places where they can play. There could also be cases of sexual abuse, sexual violence that could have resulted in such high case of teenage pregnancy. Like I said, it has not been critically studied by those in the sector, but it's something that all the relevant stakeholders are worried about.
Now, you say pregnancy, teenage pregnancy in particular in South Africa is a double pandemic. What do you mean by this?
It is a double pandemic because currently, like I mentioned, we are dealing with COVID-19 and all the challenges that come with it. And then there's an escalation of teenage pregnancy. So it looks as though now, like the social workers would have to deal with both the issues of COVID-19 and the issues of teenage pregnancy. Now, when you talk of teenage pregnancy, there are so many issues of concern. For instance, now, the teenagers are getting pregnant, which means they're having unprotected sex. Now, that has a lot of challenges associated with it because if children are having unprotected sex, they are exposed to issues of contracting sexually transmitted infections. They're exposed to all sorts of things. And when teenagers get pregnant, there's also the challenge of a child that is not physically, emotionally, psychologically developed to become a parent. And so a child that should be looked after by someone else would then have to carry on the responsibility of looking after another child. So that creates a lot of complications for those looking after the children, those working in the sector, and a whole range, for the different people. So it's double pandemic because we're dealing with the crisis of COVID-19, and then we have to deal with the crisis of that comes with teenage pregnancy.
What conversations should we as parents be having with our teenage girls and sons?
I think we all need both parents. Everyone should start having the honest conversations with young people. I think we should stop shying away from discussing issues of sex and sexual relationships among young people, because we know it happens in schools, in places where children should be safe. So I think we should start having honest conversations. There are also the issues of young people when they go to health clinics, they don't get the type of support they need. If they're looking for contraceptives, they don't get them. If they're looking for youth-friendly clinics or reproductive health clinics, they don't get those kind of support. So I think we should start having those kind of conversations so that we can better support young people to prevent them from having situations where it leads to teenage pregnancy.
All right.
To prevent reoccurrence, so that in the future we don't have the kind of challenge we're having right now.
All right. Dr. Obayi, thank you so much for talking to us. He's a director of Child Welfare South Africa. Dr. Beni Obayi speaking to us about Child Protection Week, which is commemorated then the last week of May. And this year's focus is on the challenges of teenage pregnancy.